All right. Hey ho, let's go. This is Resistance Radio, where natural selection keeps trying to wipe us out and we keep filing appeals. So there's a lot here today. We have a weekend to catch up on. So let's set the stage for this briefing. The microbes are busy and our systems are tired. In the last day, the nationwide cyclosporiasis outbreak tied to fresh produce and fast food has climbed to at least 1,645 lab confirmed domestically acquired cases, with more than 5,100 additional illnesses under review across 34 states. Think of this as filling every seat on a typical large commercial jet 15 times over, with everyone needing a bathroom now. This is the unglamorous diarrhea that quietly backs up emergency departments and med-surg beds, especially in communities that are already tight on capacity. In New York City, Legionnaire's disease cluster in the Upper East Side has grown to dozens of cases and multiple deaths linked to contaminated cooling towers across several zip codes. Picture one big high rise worth of older, medically fragile residents suddenly showing up with severe pneumonia, not because they did anything wrong, but because the building level and city level maintenance systems failed them. And abroad, of course, we have the Ebola Bundibugyo outbreak in the Democratic Republic of the Congo and Uganda that continues to strain already fragile systems, with over 2,000 confirmed cases and hundreds of deaths reported, and case counts are still climbing. That's like wiping out an entire small regional hospital's worth of patients every few days in places that never had enough ICU beds to begin with. Meanwhile, the global Andes hantavirus outbreak linked to the MV Hondias cruise ship has officially been declared over by the WHO, with 13 infections, 3 deaths, and more than 650 contacts traced across 33 countries. Imagine if every person in a crowded movie theater had to be tracked, called, and medically cleared because 3 people in the front row got critically ill. That is the level of contact tracing that just saved a lot of lives. And Europe's disease map threats look like a patchwork quilt of climate and travel. Vibrio and warming coastal waters, West Nile virus, H5 and H5N1 influenza, Salmonella Stanley, Crimean Congo hemorrhagic fever, and imported cyclosporiasis, plus a new tool to monitor infection risk in coastal waters. Translation: your friend's little swim in the Baltic and long weekend in Greece can become your consult for encephalitis and or septic shock 2 weeks later. And running underneath all of this is reporting from Alaska and elsewhere that ties Trump-era cuts to health programs, environmental monitoring, and surveillance capacity, plus ongoing CDC understaffing, to rising Vibrio infections and other climate-linked threats, even as the agency tries to gear up for Ebola and more. This is part of the story we almost never tell clearly. Outbreaks don't explode because microbes suddenly become ambitious. They explode because budgets got cut and people who were supposed to keep the water clean, the towers disinfected, and labs staffed were never hired, or more likely, they were just recently laid off. So this brings us to lettuce, lawsuits, and the Lyme plan. So let's talk about Cyclospora, because thousands of people are sprinting to bathrooms, and the fight is somehow about lab minutia and lettuce branding. As of mid-July, the CDC is tracking, as we said, more than 1,600 confirmed cases of cyclosporiasis across 34 states, and 5,000 additional illnesses are still under review. If you're trying to picture that, think of a mid-sized high school where every single student is out sick with weeks-long relapsing diarrhea, then multiply that by 4. A big share of these confirmed cases are linked to shredded iceberg lettuce served at Taco Bell in 5 Midwestern states. That's Michigan, Ohio, Indiana, Kentucky, and West Virginia. Early on, the FDA announced that lettuce sample from Taylor Farms to Mexico had tested positive for Cyclospora. That's the kind of headline that instantly turns into "Don't buy anything from Taylor Farms ever." Then over the weekend, the FDA pulled that emergency brake after re-review. Their own lab experts decided that Cyclospora result was a false positive that does not represent true amplification, and formally apologized to Taylor Farms. At this point, there are 0 confirmed positive product tests for Cyclospora in the Taylor Farms inventory. So, case closed, Taylor Farms exonerated, let's all go home? Not exactly. Even with the lab test retracted, the epidemiology and traceback still point in a familiar direction. Shredded iceberg lettuce served at Taco Bell in those 5 states. They also happen to be supplied by Taylor Farms, lining up disturbingly well with where and when people got sick. So imagine you're investigating a house fire. The lab test said this match is charred, and that turns out to be flawed. But you still have a video of someone standing on the porch with a matchbook, and all the burn patterns lead back to the front door. That's essentially where we are. In response, Taylor Farms to Mexico voluntarily recalled all iceberg lettuce sourced from central Mexico, covering food service distribution in 27 states and some retail products like Walmart's market side bagged lettuce. Picture pulling every tire of a certain model off cars in half of the country, not because you can prove that each tire will blow, but because enough of them just seem linked to crashes that you just stop taking the chances. And at the same time, Taylor Farms emphasizes that its branded salad kits and most retail salads are not involved in the outbreak or recall because they don't use iceberg lettuce from that affected region. So if you're standing in the grocery aisle, the short version is this: the plain sounding shredded iceberg and food service bags are the problem. Those are the problem. The fancier Taylor Farm salad kits and clamshells and bags are at this point not likely to be implicated. Health officials are still looking at whether other suppliers, farms, or types of produce might also be involved, because outbreaks like this rarely respect branded boundaries as cleanly as press releases do. And yes, that means that we're back to the unsexy backbone of good outbreak work, interviewing sick people carefully, mapping supply chains, checking invoices, and retesting when the lab signal looks weird. Now, here's an angle regarding equity. A nationwide Cyclospora outbreak isn't just about which lettuce brand makes the news. It's really about workers in low-wage food service and agriculture who are exposed first and treated last. Communities whose clinics don't have a lab can actually that can detect Cyclospora, so they get told your stool panel's negative and they get sent home again. Public health departments are trying to manage thousands of case interviews with skeleton crews because surveillance staff were cut years ago. And if you want to know why this matters, imagine all this playing out not in a glossy suburban health system with 3 GI docs on call, but really in a rural or undersourced community where EDs were already boarding patients in hallways before lettuce really got involved. All right, so the Taylor Farm story lands in a dangerous place for trust. On one hand, the FDA did something we want them to do. They revisited their own work, they admitted an error, and they corrected their record. That's what scientific integrity looks like. On the other hand, from the public's perspective, all they've heard for a week is Taylor Farm lettuce tested positive, followed by, "Ooh, just kidding, false alarm." For lawyers, regulators, and brand messengers, that's a communication fire drill. For the average person, it sounds like they have no idea what they're doing. The uncomfortable truth is that testing for Cyclospora is technically finicky and prone to both misses and false positives. And what we've leaned hard on are automated stool panels that simply don't include Cyclospora at many hospitals, especially safety net ones. So we end up with a double inequity. Wealthier systems can detect the parasite and link it to specific foods, while everyone just logs non-specific gastroenteritis and pays the bed day bill. So public health failure here isn't just one sample that was called positive then reversed. It's that we've tolerated a national food supply and lab ecosystem where a parasite spread via human feces on fresh produce can quietly sicken the equivalent of a small town across 34 states. Most clinicians were really never trained to suspect it. Many labs don't and can't test for it, and people bearing the brunt are often low-income workers and communities with the least power to demand safer food. That's not a lettuce problem. That's really a systems problem. All right, let's pivot to another place where tests, labs, and federal decisions collide, and that's the new National Lyme Disease Plan. On paper, a big federal push on Lyme's makes sense. Tick seasons are longer, territories are expanding. We finally have a Lyme vaccine candidate from Pfizer and Valneva that showed about 73% efficacy in reducing confirmed Lyme cases in a major trial. Think of a neighborhood where 100 people have gotten Lyme after a big tick season. With this vaccine, you're down to about 27 infections, really, instead of 100. That's like taking two-thirds of parked cars off of a block where vandals roam at night. But the plan rolled out by Health and Human Services under Secretary Robert F. Kennedy Jr. does something more controversial. It formally partners with the International Lyme and Associated Diseases Society and hosts a clinician finder on a government website to steer patients there and creates a framework that files Lyme's under infection associated chronic illness alongside things like long COVID and alleged vaccine injuries. On top of that, Medicare billing changes encourage managing, and I quote, chronic Lyme as a long-term reimbursable diagnosis, even when the underlying science on persistent infection is just not there. So in Jake Scott's SIDRAP op-ed, he walks through the human side of this. This patient. They usually arrive, to my office or some of my colleagues' office with a thick folder, years of fatigue and pain, multiple specialists who've dismissed that patient, and finally a specialty lab test that declares chronic Lyme. Her Western blot might have shown a couple of bands that the federal criteria explicitly call negative, but because those bands light up in a large fraction of healthy people who have never had Lyme, so this patient may have had an isolated IgM band years into the illness when immunologically speaking, it just may have replaced long ago by IgG. This is not a rare edge case. They are the rule in many chronic Lyme clinics. So the author essentially points out that when French researchers rigorously evaluated more than 300 patients referred for presumed Lyme, fewer than 10% actually had Lyme disease at all. More than 80% had something else, often something treatable: depression, autoimmune disease, multiple sclerosis, thyroid disorders, even cancer. Picture an entire busy clinic where 9 out of 10 patients are walking around with the wrong label on their chart. That's not inefficient. That's lethal in slow motion. Then there's the treatment harm. In 2017, the CDC and Stanford physicians published a case of patients gravely injured by quote-unquote chronic Lyme regimens. One woman in her 30s died after months of IV antibiotics through a line that seeded her bloodstream with bacteria. Others lost crucial time for cancer or ALS while being treated for infections they never had. And clinician surveys show that many chronic Lyme clinics charge thousands in consult fees without even a physician present, offering menus of long-term antibiotics, ozone, herbs, and essentially infusions, which are all really at the end just leading to confusion. So when the federal Lyme plan builds a front door to that very ecosystem under the banner of compassion, it really creates quietly 2 layers of inequity. Patients with no money and desperation getting steered into expensive, unproven, sometimes dangerous care that validates that their diagnosis, but not necessarily their biology. And patients in under-resourced settings often getting their real fatigue, pain, and cognitive fog chalked up to nothing serious, or it's all in your head, because there's even less incentive to invest in proper primary care, mental health, rheumatology, or even neurology. So instead of funding the slow, hard work of truly multidisciplinary care, where someone says, I believe you, and we're going to look beyond Lyme, we're building a billing code and a finder tool around a diagnosis that oftentimes isn't actually even very real. So what ties Taco Bell lettuce, chronic Lyme clinics together isn't just microbes. It's how we keep choosing the wrong cures for structural problems. In the Cyclospora outbreak, the wrong cure is pretending we can lab test our way out of gutted environmental oversight, underfunded surveillance, and a food system that runs on razor-thin margins and squeezed farm workers. We blame one brand, one field, one batch, instead of asking why our inspection systems and sanitation protections are weak enough that fecal contamination can ride inside our salad bowl from central Mexico to a drive-thru in Ohio. In the Lyme world, the wrong cure is building a federal architecture around a contested diagnosis in a parallel medical system. So instead of funding early stage primary care, mental health, pain management, and a vaccine that could prevent thousands of infections a year, it comfortingly says, we see you chronic Lyme's patients, but then sends too many of them down the same path that failed them in the first place. In both settings, the people who pay first and hardest are those with the least cushion. The person working two jobs who can't just stop eating out, but also can't afford to miss 3 weeks of work because of uncontrolled diarrhea. The woman whose pain and cognitive fog are real and disabling, but who gets shuffled between specialists because the only door that is open is expensive chronic Lyme clinic out of pocket, and then the communities living near warming coastal waters with increasing Vibrio risk or under poorly maintained cooling towers that become aerosolized pneumonia machines in the form of Legionnaire's disease because the monitoring budgets have vanished. Public health failure is not an accident of nature. It's a policy decision disguised as bad luck. We defund the inspectors, then act surprised when contaminated produce spreads a parasite to thousands. We underinvest in vaccines, then spend fortunes on unproven long-term treatments. We cut environmental and infrastructure maintenance, then blame individuals when Legionella blooms in the mist outside of their apartment buildings. So, what does a sane, equity-focused message to the public sound like today? If you ate at Taco Bell in Michigan, Ohio, Indiana, Kentucky, or West Virginia, and you've had relapsing watery diarrhea for more than a week, especially if you're losing weight or can't stay hydrated, ask your clinician specifically about Cyclospora testing, or just even get treated with trimethoprim sulfamethoxazole, also known as Bactrim. You're not being dramatic. We are in an active outbreak. If your clinician tells you your panel is negative, it's fair to ask, does the panel actually test for Cyclospora, or do we need a different assay? Again, that's not being pushy, that's being informed. And if you're someone with long-standing fatigue, pain, and brain fog, and your Lyme story doesn't quite add up to clear exposure, no convincing test by CDC criteria, no response to a reasonable course of antibiotics, it's not a betrayal to ask, what else could this be? Believing yourself does not mean having to cling to a label that may be blocking you from a more accurate diagnosis. And if you're a clinician or policymaker that are listening, one, thank you. But every time you hear chronic Lyme's disease or mysterious GI bug, ask what upstream investment have been made that visit could have been unnecessary. Maybe safer food and water, better tick control and vaccination, better primary care and mental health, properly resourced public health labs. When we talk about personal responsibility and individual choices, without talking about who controls the water testing, the cooler tower maintenance, the farm worker protections, and the surveillance staffing, we are not doing health. We're actually doing blame. So this is Resistance Radio, and let's be clear about what it is that we're resisting. We're not just resisting microbes. The bacteria and parasites are doing exactly what evolution trained them to do. We are resisting the political choice to leave people unprotected while pretending the problem is their salad order or their Google search history. Thousands of people with explosive diarrhea, a city block full of Legionella pneumonia, and a clinic day of misdiagnosed Lyme are not three separate stories. They're actually one big, boring, powerful story. When we underfund the quiet, unglamorous parts of public health, we overfill our hospitals and bankrupt our patients. So today, if you want to boost your immunity, skip the supplements commercial and support the boring stuff. Health departments, environmental monitoring, evidence-based guidelines, and yes, vaccines when they're ready. That's where real resistance lives. So again, this is Resistance Radio, where we just don't fight germs. We fight the excuses that let them win. So stay curious, stay kind, and remember, if the system keeps blaming you for its failures, then that's your sign that the diagnosis is wrong. My name is Mark Allanderi, and this has been Resistance Radio. Thank you for tuning in.